DMAT stands for Disaster Medical Assistance Team, and our job is to assist local health authorities in backfilling or staffing up their local health capabilities, or in the case of a catastrophic event, actually establishing healthcare capabilities in the field.
This is a 7.7 quake that we're simulating that collapsed the high school. And it's just really important for us to get used to working together with groups that we normally don't see, using all the equipment, figuring out how to make things work and how to be as efficient as possible and take good care of the people that we need to take care of.
Practice is critical. We have the opportunity of working at mass gathering events where we have some training with the equipment and we're taking care of real patients. In this environment, we have the opportunity of using simulated patients for the more traumatic injuries that we don't often see. But it gives us a practice on how the equipment works, the familiarity with the people that we're working with, and then the differences of how things flow so that we can maximize the speed and the efficiency that we take care of those patients.
All of our team members are in the medical field all the time, or some ancillary piece of the medical field. So they know how to treat patients. Where these exercises are important is it allows us to utilize our equipment that they don't necessarily utilize on a daily basis. It allows us to interact with our partner agencies to make sure that we can function as one cohesive unit whenever we come to respond.
We get activated when there's a declared disaster and they request medical assistance. This is the team that will come with all the equipment that we're using that you see around us today to support whatever we need to. So, the injuries in an earthquake have been a lot of, penetrating trauma, glass shards, crush injuries, head injuries, and we have the capabilities to flex to whatever kind of the disaster is.
We got a chance to optimize the care practices in a simulated event, much like this. And then within a few short days, the actual tornado hit in Joplin. We were able to work with our National Guard to take down the tent from the site in Branson and put it back up at the actual scene. We started seeing patients right away within a week.
We're one of the few states in the nation that have this capability, and our ability to provide this to the citizens of the state in their most dire time of need, I think, is of huge importance.